Hello, my name is Marta Romero. I'm a family nurse practitioner student at the University of Texas in Arlington. Here's my student ID. Okay. Today I will be performing a focus history assessment and a physical assessment of a patient here. And I did wash my hands prior to coming to this room. I'll go ahead and take this journal here just to write down notes. If you could please tell me your full name and date of birth.
My name is Raul Huerta.
Mm-hmm.
My date of birth is June 24, 1980.
Okay. And can you, do you consent for me interviewing you and asking you questions and assessing you today?
I do give you permission to interview me and do an exam.
Okay. And can you tell me what brings you in today?
My throat has been hurting.
Okay. So throat hurting. How long has that been going on?
It's been going on for about 3 days.
Okay. 3 days, and is it just your throat that is hurting, or is it radiating anywhere else?
It's only my throat. That's the only thing I have noticed.
Okay, so on throat. How would you describe that pain?
It's a dull.
Okay. So dullness. What do you say is constant? Is it intermittent, or is there like a time of the day where it gets worse?
It's constant. I know it's there. Doesn't really hurt until I swallow.
Okay. And what makes it better? What makes it worse?
When I swallow it, it makes it worse. Makes it better. I take some cough drops that actually soothes it.
Okay. Have you taken any other medications other than the cough drops?
Nothing over the counter.
Okay. Any other symptoms like fever, earache, headaches, fatigue?
I did feel warm, but I don't have a thermometer at home, so I couldn't take my temperature.
Okay. No fatigue?
No fatigue.
Okay. So it does look like you do have a temperature when the vitals that we took earlier. You have like 100.4. So we'll keep an eye on that. How would you rate this pain from 1 through 10, 10 being the highest?
3 or 4.
Okay, so 3 or 4. On your current history, are you taking any medications?
I am taking Trilopex,
Okay.
135 milligrams. That's once a day, and I normally take it at night.
Okay.
I take Crestor, 20 milligrams, once a day, and I also take it at night.
And why are you taking this?
For high cholesterol.
How long have you been diagnosed with high cholesterol?
About 8 months.
Okay. Have you changed any lifestyles to try to help with this illness?
I have started exercising now. I exercise 5 days a week. I really haven't made any major changes on my diet, but I try to be more conscious and try to eat healthier.
Okay. Any current allergies, like to food or medications that you're aware of?
Not that I know of, no.
Okay. And when was the last time you seen a doctor?
I had my yearly visit in June of this year.
Okay. And you had your immunizations?
I am up to date on my shots.
Your flu shot? Well,
I did get my flu shot 2 weeks ago.
okay. So 2 weeks ago. On your past medical history, and any other illnesses other than cholesterol, high cholesterol?
No, I haven't been told of anything else by my doctor.
Okay. Any trauma, like broken bones or anything like that?
No.
Hospitalizations or surgeries?
No, I've never been hospitalized.
Okay.
And I haven't had any surgeries.
Any emotional, like depression or any mental illness?
No, I haven't been sad or depressed or anything like that.
Okay. Your social history, are you married? Are you single?
I am married.
Okay. Any kids?
I do have 3 kids.
Okay. And what do you do for a living?
I'm a construction worker.
Okay. And are you staying, safe at work?
I do follow the rules and wear a helmet and any safety equipment that they're required for me
Okay.
to wear.
Any alcohol, drugs, or smoking?
I've never smoked.
Okay.
I do drink occasionally.
Like occasionally, like how often or how many drinks?
2-3 drinks a week,
As a beer, like,
as in beer.
okay.
I don't do any hard liquor or anything like that.
And no illicit drugs or anything like
I
that?
don't do any illicit drugs.
Okay. You say you work, school, okay. What about, are you sexually active?
I am.
Okay, do you, use any type of protection?
I do use condoms.
Okay. So now I'm gonna go ahead and ask you, family history. What kind of, history does your family have that you're aware of?
So we'll start with my dad. My dad has high blood pressure,
Okay,
high cholesterol. He did have a heart attack 2 years ago, and they put a stent
just one?
that I know of.
Okay,
My mother, she has high cholesterol,
okay,
high blood pressure also.
okay,
My brother, he has high cholesterol, high blood pressure. He has obesity
okay,
and diabetes type 2 that is controlled by diet.
okay.
And I also have a sister, and she has high blood pressure and high cholesterol.
Okay. So now I'm gonna ask you a few questions about your, just your body and all that.
Okay.
How are you staying healthy? I already asked that question, but what kind of exercise are you doing?
I normally run 3 to 4 times a week. I've been training for half a marathon.
Oh, congrats.
Thank you.
Let me see what else. Nutrition, you did say you trying to eat healthy.
Yes, I cut out on eating out often. I try to keep eating out once a week. As far as major changes, and I haven't took any fat diets or anything like that.
Okay. What about your skin, hair, nails? Have you noticed any, like, your hair falling out, any skin lesions, or your nails, are they kind of attached?
No, I haven't had any issues with my hair, my nails, or any rashes or nothing crazy like that.
Okay. Your breast, I mean, you're a male obviously, but have you noticed any growth or any discharge?
No, I haven't noticed anything weird about them.
Okay. What about respiratory? Any cough, short of breath?
No cough, short of breath when I'm running, but I mean that's to be expected.
Okay.
But no short of breath
Okay.
in any other given instance.
Your cardiovascular, have you had any chest pain, any dizziness, or you feel like you're gonna pass out, or any murmurs? Have you ever been told you have a murmur?
I've never been told I have a murmur.
Okay.
I haven't suffered from any chest pain or discomfort or anything like that.
Okay.
I don't think I have anything in my heart, honestly.
Okay. Bowel movements. Are you having normal bowel movements? Are you having daily, or how often?
I do have bowel movements daily, sometimes twice a day.
You don't have any constipation problems?
I don't have any constipation problems.
Okay, no abdominal pain, nausea, vomiting?
No, nothing like that.
Okay. And have you noticed any blood in your stools?
No, I normally don't look, but no.
Okay. When you urinate, any pain, any blood in your urine?
No blood in my urine, and normally I don't have any pain, nothing burning or.
Okay. It's not frequent where you have to go often to urinate?
Correct, I don't go frequent.
Okay. Musculoskeletal, have you been have you noticed any difficulties when you walk or any change in your, ambulatory status?
No, I don't have any weakness or anything like that.
Can you didn't use any assistive devices or anything like the cane?
No,
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 okay.
I don't need to.
Okay, and let me see what else. Any have you ever been diagnosed with diabetes or thyroid, or have you felt any any lumps anywhere in your body?
I haven't felt any lumps. I haven't been diagnosed with diabetes. I know it's in the back of my mind because my brother has it, but once again, I exercise and diet control. So, as far as I know, the doctor hasn't told me anything that I'm even at risk or close to having or anything like that.
Okay. And that's it. I'm gonna go ahead and assess you and find out what's going on with you, okay?
Okay.
And after that, I'll, let you know what's going on, and if we have to give you your prescriptions, we'll go over all that stuff with you,
Okay. Thank you.
okay? So go ahead and start with your face. If you go ahead and want to turn that way. Can't see me now. Should I be? Yeah. Okay. So I'll go ahead and start with your hair. I don't see any infestations, any bald spots or anything like that. Okay. Your skin, it's warm, dry. I don't see any lesions anywhere. Okay. Your head is symmetrical, it's not bigger than your body or anything crazy like that. Let me see your capillary fill here. It is less than 3. Your legs, I don't know if I'm able to. I think you can see. Okay. I don't see any lesions down here either. No edema. Okay. Pulses are palpable. Capillaries also less than 3 here. Okay. Skin turgor is good. It goes, recoil goes right back to normal for that. Okay, your hair, skin, your nails. They are firmly attached. Nail beds are pink. I don't see any signs of cyanosis or any clogging or anything like that. Okay, your eyes, your conjunctiva is pink. Your lacrimal gland, I don't see any discharge or any swelling, anything like that. I don't see anything abnormal with your nose, any discharge that is visible now. Your frontal sinuses, are you hurting?
No.
No tenderness, no pain.
No.
Your maxillary sinuses,
No.
no tenderness. Okay. Your ears, I'm gonna go ahead and just look at the outside. I'm not gonna do a whole test or anything like that. The ear canal looks good. I don't see any lesions, any drainage. No. Let me check this one. Okay. Changing that. I'll go ahead and look at your nose, just your nasal cavity here. Looks moist, pink. I don't see any drainage or any blockage, anything in there. Go ahead and open your mouth for me. So I do see some redness back there. Your tonsils are a little swollen. I'll say 3+. I do see some white patches back there. Your teeth are intact. I don't see anything abnormal there. Your tongue is moist. Okay. Now I'm gonna go ahead and assess all your lymph nodes. Can you see me here? Nice. Okay. I'll go ahead and do your occipital lymph nodes. I don't think they can see me. How do I do it? Okay. I'll go ahead and do your post-auricular lymph nodes. No tenderness, no, are you hurting?
No.
So no tenderness, not palpable. Your preauricular lymph nodes, any pain?
No.
I don't know if you can see me. Okay, so no pain, no tenderness. I'll go ahead and do your submandibular here. Any pain?
No.
No. Your submental? No pain?
No.
Okay. Your tonsillar, does that hurt?
No.
I do feel a little swelling palpable here. Your anterior cervical, any pain, tenderness?
No.
So non-palpable, no tenderness. Your posterior cervical, tenderness?
No.
No tenderness, no, not palpable.
No.
Go ahead and do your supraclavicular, no tenderness.
No.
Okay. And once we take the shirt off to listen to your lung sounds, I'll go ahead and do your axillary.
Okay.
Okay, if you want to go ahead and turn around for me, we're going to listen to your lung sounds real quick. Can't see me. Just take that. So I'll go ahead and take the shirt off real quick. Okay, take a deep breath. Can't see my chest. Okay. That's good. Okay, if you want to turn around for me. I'll go ahead and do the same to the front, okay? So chest looks symmetrical. I don't see any accessory muscle usage or any abnormal movements there. And skin looks tan, warm, dry, no lesions or anything like that. Okay. Take a breath. Okay, I'll listen right here real quick. Okay. Lung sound clear and auscultation. I don't hear any wheezing or any coarseness or anything abnormal like that, okay? We'll go ahead and listen to your heart now. So now I'm listening to the aortic. It's on the second intercostal on the right sternum border. The pulmonic is on the second intercostal on the left pulmonic, the left sternum border. The Earth's Point is on the third intercostal on the left sternal border. Then the tricuspid is on the fourth intercostal on the left sternal border. And then this is the mitral. And it's on the fifth intercostal mid-axillary line. Okay, heart rate is about 60 beats per minute. I don't hear any murmurs or any gallops or anything abnormal like that. Respirations are 12 breaths per minute. Now, if you want to just lay down for me, I'll go ahead and listen to your abdomen. Abdomen looks normal, active. I don't see not obese or anything like that. No venous movement or anything abnormal. Go ahead and come up so you can see me. Yeah. Let's go ahead and listen to you right here. Okay. Valve sounds are audible and active in all 4 quadrants. We'll go ahead and just palpate real quick. Any tenderness?
No.
No? Okay. Now I'm just doing light palpation. I'm going to do it deeper in a little bit. Okay. Any tenderness?
No.
No? Okay. I'm going to go a little deeper. Tenderness, pain?
No.
No? Okay. Okay. And that's concludes our assessment here. If you want to sit up and you can put your shirt back on. Well, I can actually do your axillary since I didn't do it earlier. If you want to turn. Go ahead and do your axillary lymph nodes real quick. Any tenderness?
No.
Okay. So no tender, no non-palpable. Okay. Do this one. No tenderness, pain?
No.
Okay, no tenderness, non-palpable. Alrighty. So that concludes the assessment part. From my findings, you do have strep throat. I'll go prescribe you some amoxicillin pills that you can take for 10 days. But in the meantime, keep yourself hydrated, drink plenty of fluids, try to eat foods that will help you with the pain, like soups, liquids. You will take the antibiotics for 10 days. For the first 24 hours, stay at home. Try not to be around people because you can get them sick. I don't know if you ever had strep before, or do you know what strep is?
I've had them before.
So it is a bacterial infection in your the back of your throat and your tonsils. Okay, so your tonsils get inflamed, and it's painful, and it is passed through contact with other individuals. You might have been close to someone that has this. Okay.
Okay.
You have any questions?
No, thank you.
Okay. You have a good day and take care.
All right.